Okay, so moving on to the preschool age child. General characteristics, they are usually anywhere from 3 to 5 years old, uh, marked by slowing of physical growth. This is where they're mastering and refining their skills, motor, social, and cognitive. Major tasks for the preschool age child, they're obviously getting prepared to enter school. Development of cooperative type play. So I mentioned in the toddler PowerPoint that parallel play is used, and parallel play ends up leading to cooperative type play. So the parallel play and the toddler age is important to develop cooperative play here as a preschool child. They have control of their body functions for the most part. They have accepted separation from parents, when they go to school or preschool or daycare or anything like that. They don't have that separation anxiety. They have an increase in communication skills. Their vocabulary has exponentially increased. They're talking clearer. Um, Memory has increased as well. They have a better memory and then a better attention span. Physical development doubles the 1 year old weight by 5 years of age. So between 3 and 6, the child will grow taller, so they'll hit like a growth spurt and they'll lose the chubbiness from the toddler stage. And then all 20 primary teeth should have erupted by now. They have good control of their muscles, so much better coordination. Hand preference, right or left-handed, has developed by this period as well. And they're more adept at using old skills as each year passes, which goes along with their better memory and attention span. So, cognitive development. So, here we're getting into those developmental theorists. You have, again, I never know if I'm saying this right. Paget pre-operational phase is 2 to 4 year old child, and then intuitive thought, 5 to 7 year old. So if we're going by a preschool age being between 3 and 5, a child, as far as the cognitive development, could fall in either one of these in this developmental phase. So pre-operational or intuitive. Effects of cultural practices, obviously, that can influence their development, their initiative, their drive, their abilities. Parents and older siblings model language development. Like I said, for toddlers, they're gonna model behavior at home. This becomes even more the case as a preschooler, especially older siblings. Language development. So if there are any delays or problems, it can be any of those three factors: physiological, psychological, or environmental. So includes both the understanding of language and the expression of language. And in that case, maybe a speech pathologist might be indicated at that point. But of course, you'd have to educate the parents to do routine while child visits with their pediatrician if they suspect something is wrong or the child's falling behind. They need to go to their pediatrician and get the proper referrals. So make sure you're educating them on noticing and watching for those signs. All right, so bedtime habits. Engage child in quiet activities before bed. So quiet time. Establish and maintain rituals. Like I've said in the other stages, routine is key for a child to feel secure and safe. And this is important still as a preschooler. Attention-getting behavior that results in taking the child into the parent's bed should be discouraged. Rewards the attention-getting behavior and defeats the objectives of bedtime ritual. So don't, counteract what you're trying to teach the child because they know what gets them what they want and they'll keep doing it. It's that pattern recognition or intuitive thought development, and cognitive development. So physical, mental, emotional, and social development can be very different from a 3-year-old to a 5-year-old. So I would suggest reviewing that in your text, um, to get an idea about what those differences are. For testing purposes, I'm not going to get too specific on that kind of stuff. It's more focusing on educating parents what to look for at each stage. Is it normal? Is it not? Is there, you know, is there something going on that maybe the parents need educated on, or how to approach a child? So it's more about as the nurse knowing how to navigate each individual situation, each individual patient or family, and noticing if they're achieving their developmental milestones or not, and then going from there. All right, so guidance setting with discipline. Um, Children need limits for their behavior, of course. You need to educate parents to teach and gradually shift control from the parents to the child. So this is where it starts, where you want to gradually kind of give them some choices to where by the time they're an adolescent, they have more autonomy and they can become more independent as adults. But this needs to be a gradual shift. Self-discipline or self-control is what you ultimately are wanting to instill in the child. Timing the timeout. So the rule of thumb is for a timeout, 1 minute per year of age. No interaction or eye contact during timeout. So a 5-year-old needs 5 minutes of timeout. Do not interact. Do not make eye contact. And that's typically what is recommended. Not going, you know, beyond that or less than that if you want them to understand where the limits are. Rewards, don't confuse with bribes. You want to encourage positive behavior and again, instill in them right from wrong and self-control. And you can't do that if you're bribing. So if they do something and that was, they do something good, make sure you reward them for that positive behavior. But don't say, if you don't do this, I'm not going to get you this. Or if you do this, I'll get you a toy, because that doesn't help anyone. Consistency and modeling significantly influence behaviors. So again, consistency, always the consistency and routines are paramount. Jealousy. So this is pretty normal starting at this age group. It's a normal response to a threatened loss of affection, even if it's supposed, it's not an actual threat. Jealousy of a new sibling. That's the most common one at this age. It's strongest in children younger than 5. In this case, they may revert to behaviors seen at an earlier stage. They could become aggressive and bite. Tends to be seen less in only children. and children should feel they are helping with the care of their sibling. So giving them some, um, letting them assist, and it helps give them a sense of um, inclusion and a little bit of autonomy, maybe. So just making sure that they're able to help. Thumb sucking, instinctual behavioral pattern. So finger or thumb sucking, usually, I know they say that all the time, but it typically doesn't have a detrimental effect on the teeth, as long as it's di discontinued before their permanent adult teeth come in. A child who is trying to stop sucking thumb is given praise and encouragement. And of course, just like with anyone, even adults, during periods of stress or fatigue, they may regret back to those behaviors of thumb sucking, and that's normal. You got to take that into account and make sure you're educating your the parents about that. Enuresis or bedwetting. So there's primary and secondary. Primary is that the child has never been dry, so they're not potty trained, um, and that is not a change. Secondary is when they are, and there's a recurrence of it, if they've been dry for a period of a year or more. It is more common in girls or boys than girls. There are some organic causes. A lot of times, the most common cause uh, is urinary tract infection, a UTI. So if this is a persistent pattern, make sure you're educating parents to schedule an appointment with the pediatrician. Diabetes is another cause. Seizures, less so, but could be. Obstructive uropathy, abnormalities in the urinary tract, and sleep disorders. But UTI definitely most common. Um, So data collection, making sure you're getting all the information you need. What's the pattern of the wedding? Is it every night? Is it how many times a week? Is it, how much is it? Did anything in particular happen that day or night that caused it? That type of thing. Um, Number of daytime voidings. Are they holding it all day and then it just comes out at night because there's so much and they can't hold it and they're afraid to get out of bed. Um, and then again, don't make sure that they don't drink too much fluid before bed. Family history, medications, and stress. All right, so preschool programs. So we're talking about school now. Preschool programs provide structured activities, foster group cooperation, and the development of coping skills. So these are the key benefits of putting children of this age, 3 to 5 years old, in a preschool program. It is beneficial and does help with socialization and getting into that structure, that mindset of schooling. They gain self-confidence and positive self-esteem as well. Daily care. So daily care hygiene, it's not as extensive as it was as like a baby and toddler, but they still need to bathe each day and shampoo hair at least twice a week. Make sure clothing is loose and not restrictive. Sturdy shoes. Accident. So when we're talking about safety, accident, injury prevention, always an important topic to educate parents on. So accidents, they are a major threat to 3 and 5 year olds. Car safety obviously is essential. Um, Burns, because they're, experimenting. They want to see what maybe the stove does, or they find a lighter or something like that. So that's another cause. Poisoning, because they can access items more easily within their environment. They should be taught the dangers of talking to or getting in a car with strangers, and don't play in secluded areas. And indirect supervision is necessary because of poor judgment. They don't have that judgment capability yet. So with toddlers, you wanted to always be supervising. With this age group, indirect supervision is what they're trying to get across. Play and health and illness. So in this age group, the value of play, physical, mental, emotional, and social development, which is, pretty intuitive, increases communication with other children, which is very beneficial. The nurse's role, include the child starting at this age in their plan of care. It can be little things, but just make sure you're talking to them directly. You're giving them small forms of decision-making autonomy. Um, like what color Band-Aid do you want? Do you want that? Stuff like that. Factors to consider, their state of health, of course. Overstimulation and fatigue can affect their temperament, their demeanor, and diagnosis should be considered when choosing toys. So this is if you're in a hospital setting. There are different types of play. There's therapeutic, play therapy, art therapy, and just general play. Should be non-competitive, so not like those competitive sports, and just help them adjust and increase their independence. Um, these are just special needs, special considerations for children that have any neurodivergent or motor disorders. They may need more stimulation through play than the child who's not um, neurodivergent or motor impaired. Um, Consider mental and not the chronological age. And play needs to be supervised because of poor judgment. And repetition is necessary. Okay, that's it for the preschooler.